So we have got some case studies, which is the really exciting part of this afternoon. And we're going to hear from small, medium enterprises and startups who are really leveraging AI in their business. So our first speaker is Stef Kohler. Stef's a co-founder of Ligantic and has been able to channel her passion for enabling entrepreneurship and leveraging technology to enable creative adventures and endeavours. With locations in Bendigo and Melbourne, Ligantic is spearheading the democratisation of technology, helping professionals and small businesses leverage AI-driven solutions through their professional and some starter subscription models.
So I'm going to take you through, when I was sitting down and thinking what are the case studies I was going to present today, I went through all of our for-profit where we've helped businesses optimise and automate, but the one that I'm really passionate about is our for good cause. So what I'm going to take you through is a case study on our digital assistant for rare diseases, where we're transforming support with AI. The Ligantic team, we've got myself up the front here, and in the exhibitor hall you would have seen Mark Kohler, who's our technologist and platform builder. And if anyone wants to partner with us, you'll get a chance to meet Carmen Price, who's our COO. So rare diseases. A rare disease is a disease which impacts 1 in 10,000, which doesn't sound like that much. But there are actually 7,000 different types of rare diseases, which equates to 2 million Australians living with rare disease every day. It's about 8% of our population. When we talked to these communities, we found that some of the biggest challenges that they were facing is timely access to trusted information and the ability to access specialist clinicians. So we've partnered with Prader-Willi and FAST Foundation, which are 2 of the rare disease communities located and very active in Australia, and we came together with the co-design system on how might we harness emerging tech to support these rare disease communities. And so what we came up with was the lofty goal of the digital health assistant. The intention here is that we could improve the well-being, the social and the economic outcomes for carers and individuals living with these diseases, while simultaneously reducing the cost to the medical system through proactive care. It's a big vision, and so we wanted to start with the first step. And the first step was, can a chat or a conversational interface with trusted context, with clinician reviews and human in the loop provide value to these communities? And so we got to designing that, we got to building that on our Ligantic platform. What you see here is the conversational interface that is trained on the Prader-Willi context. In the back there, the clinicians and administrators can review the responses that have come through, make sure that they're approved with it, and if it is approved, then it goes through and gets a validated response. So building out that knowledge base and information set behind it, whilst providing iterative value to the community at the same time. So we did put a lot of safety guardrails in this case study because it's such a targeted community. We wanted to make sure we were doing responsible application of AI. That looked like having a closed system with trusted context. This doesn't have any outlets to the rest of the exhibit. It's really closed, and that gives us some of the safety layers there. We've also got guardrails against diagnosis. This is not a diagnostic tool. It's about connecting and supporting the communities that are working and already have this space. And we have trusted clinician reviews. One of the biggest focuses of our digital assistant was around multiplying the impact of these specialist clinicians because they're so well trained. They are at the top of their field, and they don't have enough time to see everyone in their communities because of regional and disparate locations. We've got complete traceability. That's something that you get for free when you build on the Ligantic platform because all of the executions that run through our platform have complete observability and traceability included. And we've used this as a tool to identify gaps and inconsistencies in the knowledge base. It was really great in the pilot because we were able to see that the community was asking questions that the knowledge base didn't have any responses to. So the researchers have then been able to use that as quantifiable community-led research areas, and they're able to expand their knowledge base where they want to go. Very exciting stuff. And we have correction alert notifications. One of the original challenges was that trusted information is hard to get. It takes a lot of time for these rare disease communities. And so when we had the clinicians reviewing it, even if it was 2 weeks later, and they said, oh, I would have rewrite that differently. Oh, that's the incorrect information that's been put forward from this. They would get a proactive notification onto their profile to let you know there's an update in information. When there's new research that comes out that would change some of the historical chats, then that goes through the system, it reviews it, and they have a proactive correction alert. So it changes it from a pull method, where they're spending a lot of time and money, effort, trying to find the latest information, to a push method. You've asked something about this before, your community is now providing you with that information proactively. So I've talked a little bit about the pilot that we ran, and what we did was we had 64 documents that were processed through their knowledge base. These were all the clinician-reviewed approaches. We had hundreds of chat messages come through in the 2 weeks where we ran this pilot, with a 10% chat feedback response, where either the community or a clinician was giving feedback on it. And we generated 81 clinician-reviewed and approved responses, which helped to improve their knowledge base over that time. But one of the key learnings, the impacts that came through for me, that really made it sing, was the testimonials and quotes from the families who went through our pilot. They were talking about how it was removing the stress, it was having a vast impact and immense value. It was more than just an AI tool. This was going to save them hours of research.
Yes.
It takes the burden out of an already stretched family who are working through with these rare diseases. It is a game changer for the Prader-Willi community, and that they would improve the quality of life. Now, we were intending on having this just as a 2-week pilot and then continuing to go back to product development. But we've actually gone out and made sure that the people that went through the pilot who wanted it continue to have access to this system. And so what's next? We've continued that development. We're very excited that we're actually just finalised the elements where we're going global with this right now. We're exporting this out to the US faster, which is very exciting because we're going to have a lot more community members coming through and going to be able to provide that value to more community members. We're also talking with, outside of the 2 communities which we co-designed this in, more rare disease communities. Because the way that this has been designed, we're able to replicate it again and again and again, and the tech can continue to provide value to multiple community members. And we're also adding more capabilities. That's coming through our Ligantic platform development. We're expanding on the capabilities that are unlocked in that, but also in the product design that we're overlaying into it. We're looking at verbal conversations, so you can actually have a conversation with it out loud, specifically for rare disease communities who have eye deficiencies, so that accessibility is going to be a large part for them. We're looking at translations, both between languages, but also between reading levels. So if someone's having research elements that can really bring it down in the reading level, and more. So, big thank you.